I'm Ifeoma Anagbogu. I'm a consultant to W.H.O on Guinea worm disease eradication in Kenya. Well, I must commend Kenya for the very good disease surveillance system they have. And all we need to do is just to do things a little bit differently, make our surveillance system more sensitive, engage the community more, and engage other stakeholders so that it's an all hands on deck approach. Because yes, we've eliminated Guinea worm disease, but we have to provide verifiable evidence to WHO to be able to consider Kenya for certification. And that we're going to do to add impetus to what we're doing. There is a cash reward for 100,000 shillings. Every Kenyan, a minimum of 50% must know this. And in Turkana, where we had the most cases, a minimum of 70% must know this. And everybody must know how to prevent Guinea worm disease. That's by drinking protected water, drinking water from protected sources. And finally, every health worker must know the appropriate response to Guinea worm disease. That's to investigate immediately and report. Every suspected case of Guinea worm or rumor must be reported immediately to the nearest health facility or health worker by everybody, every Kenyan. And there is a cash reward, 100,000 shillings, for any confirmed case in Kenya. We have been doing that, and especially at this meeting, requested everybody, stakeholders, health workers, Kenyans, to get the community level involved, the community health volunteers to talk to the community members, and then to re-strategize our communications strategies to focus more on the community level through community-based organizations, through institutions that work directly with the communities, and then through even you notice the internal chieftaincy affairs office is represented here, the internal defense, and then other partners and stakeholders that have been working with Guinea worm disease. We have the missions, we have the religious groups, we have various associations, we have the Water and Irrigation Ministry, we have the Education Information, we have the Kenyan Certification Committee, and then we have, most importantly, these disease surveillance officers here from the counties who are expected to go and cascade the training they get here to their colleagues in their various domains. This, we hope, will encourage the community members to also buy into this program. And then we have other communication strategies. We're using radios, we're using town announcers, we're using the television, we're using posters like this and others. We have flyers, we have car stickers. We're really using a multi-pronged approach to attack this. And I know we will win. No, once Kenyans get certified, remember there are still countries that are reporting cases. We have Ethiopia, South Sudan, Chad, and Mali. And South Sudan and Ethiopia happen to be neighbors to Kenya. So we really have to be vigilant. We have to be vigilant to look out for cases. God forbid that there will be any cases, but we must intensify our effort at the borders especially to make sure there is no imported case. And even if there is, it will be contained immediately. So surveillance continues until there's global eradication of the disease. The last statement I'll make is for all Kenyans to please show interest to this, get committed to this national resolve to ensure that Kenya gets certified as a Guinea worm disease-free country by WHO. And that is by reporting any suspected case of Guinea worm or rumor to the nearest health worker. The health workers should respond immediately within 24 hours to verify these rumors. And everybody should know that Guinea worm can be prevented by drinking water from protected sources. And if by any chance a confirmed case is found here, there is 100,000 shilling cash reward. Every Kenyan should know this. And by that, we are strengthening the surveillance for Guinea worm disease nationwide. Guinea worm should be treated as an emergency at this time to make sure we are certified. And we expect the certification team to come this year and certify Kenya. consider Kenya for certification this year. By God's grace, it will happen. We will win. We are joining hands to make sure it happens. Christ our Lord.